at the moment in India, thanks to COVID-19. I've been sort of stuck here since March of last year. But I keep reminding myself that being in your home doesn't mean that you are stuck. But the other side across the pond is also my home, which I miss dearly, and I miss quite a few of you as well. So this is a great opportunity for me, and I am so thankful to Dr. Woolridge and all the organizing committee members for giving me this opportunity to share some of my understandings about this thing, and giving me an opportunity to share some of my experiences on this side of the world, since most of us have not been able to travel for a really long time now. So there are three things that I aim to do today in response to this thing. The first thing is, I want to, for all of us to be on this one common page, an understanding as to what all does World Health Organization does. And it is important to understand the scope of its work. And we will start from that macro picture, and then we will come down to what WHO did. When the COVID-19 started, it was 31st December. I'll take you through some of the timelines and some of the things that happened. And what all has it done? I'll try and, if time permits, take you through some of the uh, instances, very specific instances in different countries and different communities of what World Health Organization has done, along with, of course, the big main issue regarding, the flack that WHO has gotten because of, its response, whether it was right or not. And I'll definitely make sure that we have time for some discussion, because again, I have as much to learn from all of you. So I want to make sure that I get some inputs and a healthy discussion going. So before I begin, I just want to make sure that am I um, visible and audible to you all properly? Okay. Um, it's been almost a year in India, and my accent has become more and more Indian. So please pardon me. I'll try to be as um, Ohio's northwestern. I'll try to bring it in, but please pardon me if that doesn't come, because I haven't spoken to anyone, with the accent. So, all right, let us begin. So, World Health Organization, of course, as you all know, it started in 1948, and one thing that is, so while I was preparing for it, the one thing that I had to constantly keep reminding myself is that this, what we are talking about, what I'm going to talk about, is the World Health Organization. And the term world is very important over here, because what happens is that we, despite our best efforts, we end up narrowing ourselves, and sort of restrict our understanding of these transnational organizations to a single community or a single region or a single country and things like that. But that is definitely not the case. World Health Organization works in almost 200 countries. It has operations over there. And there are these n number, thousands of invisible people all around us that do so much that we never really understand, realize, until we really take a deep dive in. What reaches to us through different media streams, be it social media, television, news, briefings from the World Health Organization, newspapers, in my humble opinion, is, you know not more than 3% of what everything they do for us. So I will begin with an understanding of the scope of the work, the different areas in which World Health Organization works, and then we will move on to the second part of the agenda. So World Health Organization has actually worked extensively on immunization, vaccination, and eradication of many diseases which were contagious and devastating. One of the prime examples is that of smallpox. Smallpox is one of the greatest victories, and I want to start with something positive, something awesome. By the way, I forgot to mention this. Congratulations on having a the election all the way from November ending until now, and after everything that has happened, U.S. Has demonstrated again that certain things do happen the way they should. So congratulations on that. So smallpox is one of the greatest victories, and in 1980, smallpox was declared as eradicated by a worldwide immunization campaign, which was led by World Health Organization. So far, it is believed that smallpox is the only infectious disease to have been entirely eradicated. Um, Along with that, it has led numerous other immunization efforts, and it has brought life-saving vaccines to millions and millions of children worldwide. Tuberculosis, TB. My mother had tuberculosis while I was in her womb. My father had tuberculosis. A lot of members in our family had tuberculosis, and there was nothing they could do when they had tuberculosis, because I would hear stories. There was a place they would refer to as a sanatorium, and in this location called Panchgini in India, which is sort of a hill station on the in the Western Ghats, they would be shipped over there, and they would have to spend like 6, 7 months, 8 months, up to 2 years, and just hope that they recover. So tuberculosis, through immense global efforts led by World Health Organization, 53 million lives have been saved since 2000. And this has been mainly because of expanded prevention, diagnosis, and treatment in areas where none of these are available. Malaria. So deaths through malaria have dropped by 60% between 2000 and 2015. And of course, along with World Health Organization, there are many other major players. Bill Gates Foundation, they are playing a huge role. And because of COVID-19, one of the worst side effects is that malaria has taken a backseat. The funding that was usually supposed to go towards malaria has had to be diverted towards COVID-19 response. And because of that, and according to an estimate, that we have been pushed back by 5 years in our progress. So it's a tremendous blow to the progress that we had made, and in regards with malaria, and it still is one of the diseases that kills the maximum number of people. And unfortunate that COVID came, and now we have a double-edged sword where malaria is taking a toll, and so is COVID. Water and sanitation, waterborne diseases are of course a huge deal, and I'm pretty sure that there are many people over here in the screen who have either directly or indirectly come in touch with different their efforts and their work in Africa especially, and many other underdeveloped nations where waterborne diseases are uh, extremely terrible, and World Health Organization plays a key role in promoting health and reducing some of these transmission of waterborne diseases. After that, tropical diseases. And there are many tropical diseases which are neglected. So World Health Organization, through its efforts and networks everywhere, works with these countries and partners, so to sort of provide care for people affected by such neglected tropical diseases. And they have been successful in eliminating many of these. They say that one of the tropical diseases, guinea worm, is almost on the verge of eradication. Uh, it has not been eradicated yet, but it is on the verge of it. So this, again, I bring this up because we don't get exposed to a lot of this until and unless we are a part of this type of an area or a region. We would never ever know about the type of work that happens. And tropical neglected tropical diseases is another area. And then of course there's a lot more. HIV/AIDS, it still continues to be a major global health issue, but some bold new recommendations for earlier and simpler treatments, along with efforts to facilitate access to cheaper generic medicines. They have helped save almost 21 million people. They have enabled access to these people. I know, I was speaking with an aunt of mine. She lives in New Jersey, and I never knew what she did. So I just asked her that, what do you do? Where do you work? She tells me that, you don't know where I work. I said, no, I know you work, but I've never asked you. And she is one of the persons who has been working in the HIV/AIDS, countervailing unit, not through World Health Organization, but through, Department of Health and things like that in the U.S. government for over 20 years now. And she says that HIV/AIDS is on a tremendous rise in New Jersey area. We have no clue about these things. HIV/AIDS has pretty much gone, it's like, we've brushed it under the carpet. We don't really talk about it. We manage life, we manage the quality of life, but we don't really speak about it. But it is increasing, it is out there. And agencies, transnational agencies, I mean, I bring in New Jersey because it is very close. There's just one state between Ohio and New Jersey, that's Pennsylvania, right? But imagine places like Suriname and Jordan and Somalia and Indonesia and Mali and Cambodia and whatnot. World Health Organization actually goes and is still working by making life easier, quicker things, and of course the prevention. India did major campaigns, and while I was growing up, practically every local transportation bus had all these messaging and information about HIV/AIDS that doesn't spread and things like that. There is an essential medicines list. Not sure how many of you know about it, but there is an essential medicines list, and it gets revised every 2 years. This is something that the World Health Organization, along with a few partners, they determine. This list is a guide for every country on the planet that they should have. These are like a list of core medicines that every country needs to have for a national health system, a proper national health system. So to identify the movements of diseases, pathogens, bacteria, viruses, microbe, this is all being tracked continuously, and they sort of, keep on updating and revising this list and a guide, and all the governments, they understand and they take those type of actions to make sure they have enough provisions for these sort of things. um, Pregnancy, the you know it's it's one of the major issues. uh, we've always spoken about infant mortality and things like that. But on the other side, pregnancies all across the world have become extremely stressful. um, I don't know what is the reason, but they have become extremely stressful. It could be the lifestyle, it could be the pressure, it could just be the changing norm. But they have been extremely stressful, even in nations, developed nations, where there is access to proper medical health. So, World Health Organization is extremely committed to improving access to safe, effective, quality care, which is affordable for women. Um, Other than that, adolescents, road traffic accidents, suicide, um, low respiratory infections, these are on a rise. India has gone through some very weird suicidal. We had huge impetus in farmers committing suicide, but now it's the youngsters. There was a major film star. It was like, um, Robin Williams. How it was a shock in United States when he committed suicide. Similarly, in India, a lot of young kids now are committing suicide, and it's such a weird and bizarre. Of course, World Health Organization works in these areas to provide better services and things like that. Aging population. Since 1950, the life expectancy has increased by 25 years. Healthy older people, they contribute to society in so many ways, and neglect of elderly people is a terrible thing that we see all across the world, because their value and their position in the society is merely measured by economics, like, how much money is the way they are valued, and that's not the right metric to value them. So World Health Organization is, focused on helping people continue doing what they enjoy, and of course a lot of mechanism, a lot of infrastructure, a lot of facilities, access. So one of the things, I remember I would come to the senior center on Wednesdays and play cribbage at one point of time. I have never seen any such facility in India. The only things that I have seen are old age homes, where, anybody, like a nursing home, where people, when they can't take care of themselves, you go. But there are two reasons. One, because the family structure is still very strong, but there is such a huge gap. Like, there's no such a positive community gathering place for people of a certain generation to share their life, to come together and, engage in things that they enjoy. There is just not a place or a space, or even that idea for that matter. um, Non-communicable diseases, cancer, diabetes, heart disease, it is unbelievable, but they now account for 70% of all the total deaths on this planet. It's the non-communicable diseases. Um, so who goes and puts their time and effort and energy and resources World Health Organization. They promote a lot of things because some of these are related to lifestyle. So they promote healthy eating, physical exercise, health checks, and these are pretty much the cornerstones of non-communicable disease prevention and control. Cancer, number of people being diagnosed has of course increased, and over the next 20 years, it is sort of going to increase by 70%. And early identification is a huge game changer when it comes to cancer. And many on this screen. So here's my, until I was in India, I lived in India for 25 years. I did not know anyone like in my family, in my friends, or anyone who had cancer. 2010, I came to United States. 2010 to 2021, I don't know, but I now know a lot many people who have either defeated cancer or have unfortunately succumbed to it. And I'm sure you all have lived way longer than I have. So I hope you have come across such instances, and it is just painful to go through it or see someone go through it. Tobacco kills more than 7 million people every year, and measures to bans, advertising bans, smoke-free laws, and this is helping almost 2/3 of the population. I think Bowling Green State University in 2014 became a tobacco-free campus, and then there were designated spots and things like that. But a lot of movement which comes from this side is happening. Disability is another thing. More than 1 billion people have some form of disability. Can you believe that? 1 out of every 7 person on this planet have one or the other form of disability. How are we caring for them? How are we making sure things are taken care of them? Their issues are very well enveloped in our development policies and programs. It's requires a lot of advocation, policy determination, policy changes, which is all sort of done by increasing awareness by World Health Organization. There's road safety, but I've already mentioned about it. Mental health in emergencies. So, although despite we have enjoyed a prolonged period of peace and stability, the number of people who are living in emergency situations or temporary, or the people that are displaced, has constantly increased. There are places on this planet where people have lived for 70 years in a displaced sort of a way. There are refugee camps for over 70 years, and people have lived their life. They've been born over there, and how do who takes care of their mental health emergencies, their issues? So World Health Organization, it coordinates all the humanitarian, through the humanitarian agencies, all these emergencies, and they coordinate and ensure that the intervention is effective. It also played a major role in Zika virus in 2016. Another major issue is the antimicrobial resistance, which we are developing and we talk about. So what needs to be done, what are the action plans, systems, surveillance systems to help and prevent and manage some of these things. Our resistance by bacteria, parasites, viruses. So these a lot of R&D policies, monitoring happens. Identifying health trends, monitoring disease. So why are people falling sick? Who is falling sick? Is it due to where they live? Is it due to what they earn? Is it due to what they eat? Is it due to something else? All of these things is tracked by that. So I don't know if you have noticed this or not, but at least in the last 2 years before, I noticed that advertisements for pills, of course, a lot of other, but advertisements for pills regarding constipation, especially in women, have increased. Uh, how do you make sense of it? What is happening? What is happening to almost the 50% of our population? Why are suddenly there so many advertisements and so many products in the market for this particular thing? Somebody has to make sense of it and ensure that we prevent it. And we all know that our mind goes for a toss when the system is not working very well. Of course, responding to outbreaks and emergencies, public health emergencies in different countries on these planets and things like that. Humanitarian emergencies, many outbreaks happen at the times of natural disasters, and natural disasters have been increasing substantially. So that is a huge aspect of it. Another, this is that they advocate strongly for, is the universal health coverage, and COVID has given a lot of momentum to that, the universal health coverage for everyone. Not going too much deep into it, but so this is the scope of the work that World Health Organization does. And again, this is also a snapshot. Of course, I could have taken the entire hour and a half and could have gone until the cows would have come home. But this is the scope of work that they do. And there are thousands of invisible people that are working around us constantly to ensure that, we don't get touched by some of these things. Coming to COVID, of course, it's a game changer in a lot of ways. I have been trying to reach out the elders in my family and ask them that, have you ever seen something like this in your lifetime? Have you ever experienced something like this, in like the past 70 or 80 years, where you had to go through certain things? And I think the only thing they mentioned was not in their generation, but their generation above them, was plague. When plague came in, there was a similar scare, and people were getting very antsy, and there was a lot of anxiety and stress because there was no sight in it. And then, of course, there was no technology over there. I don't even know, by the time the word vaccine, there might be a handful of people, 30 or 40 people on this entire planet who would be using the word vaccine at that point of time. Now we have a vaccine in 9 months, 10 months, and there are already people who have vaccine in their body, which is a pretty stunning feat. um, what does World Health Organization do when things like this happen? So as I said earlier, it is constantly monitoring. So when I was thinking about it, there is a program in Bowling Green called Citizen on Patrol. It is open to students, some students, graduate students, and faculty and staff members of Bowling Green State University, where we undergo through some training, and then we become the eyes and the ears. No, sorry, eyes and the ears. I always mess it up. Where we become the eyes and the ears of for the police, Bowling Green Police Department, for 2 or 3 nights, and these are the days when new students are coming onto the campus, and there is this always this irksome problem of certain parties, block parties, and there are some very hurtful posters that are always displayed, and things happen. So similarly, World Health Organization also has these ears and eyes and things like that. They're constantly monitoring, and they are monitoring practically every major and minor media release regarding any health stuff that goes on. So I'm going to walk you through for a little bit about the sort of the response timeline, what happened and things like that. And this is the early thing. So I will take you back all the way to 31st December 2019. And this is when there is a country office in China, World Health Organization's country office in China. Constant surveillance. It picked up a media statement by the Wuhan Municipal Health Commission. So they were scanning and searching, and they went onto this website on Wuhan's municipal health, like our county office or equivalent to that, or even the local administration. And there were cases of viral pneumonia in Wuhan. So they immediately raised an alert and notified the international health regulations focal point in the Western Pacific Regional Office about this statement. And of course, it was all in Chinese, so they ensured that it was very well translated and things like that, and they send it further. And World Health Organization's epidemic intelligence from open sources. So there is a platform. Of course, there is a lot of technology and programming and artificial intelligence that goes behind it. It is referred to as EIOS, and it is constantly all the open sources that are there, means everything that is that you can access without a password, essentially, on the internet. It constantly scans this, and yeah, we can talk about things like privacy and whatnot and things like that, but this is they scan it, everything that is open and available. And so EIOS also picked up a similar media report on ProMed, which is an international society for infectious diseases, about the same cluster of pneumonia of unknown cause in Wuhan. And the ears went up, eyes went up, and they started looking for more information. And of course, WHO on 31st January, December, this was picked up. On 1st January, WHO contacted Chinese authorities and requested more information of what was happening with this atypical form of pneumonia. And on the very next day, it activated something that is referred to as the Incident Management Support Team, which is part of the emergency response framework. So, and that this particular, the IMST, it coordinates action plan preventions at 3 different levels: the local level, the national level, and the regional and the globe. I mean, local, national, and global. So all 3, it then coordinates, starts activating things. So 31st December, a report was picked up. 1st January, they started requesting information, and everything started going on. 5th January, first report was shared with detailed information about this unknown sort of pneumonia through its event information system, which was made available to all the member states, means pretty much entire globe is covered by that. And the number of cases, who should take precautions, what sort of precautions should you take. So say, for example, if it has happened in China, they will track down who are its neighboring countries, where are the major flights going, all the things. So they also identify that. 10th January is when World Health Organization reported that the Chinese authorities have determined that the outbreak is caused by a novel coronavirus. It's something new. We have not encountered it, but this is the thing. And again, of course, the R&D mechanism now started, getting activated. It held its first teleconference on 10th January. The scientific advisory group came into action, and the director general of World Health Organization spoke with the head of National Health Commission in China. So a lot of things are happening. See, in just a matter of 10 days, all of this has happened, and it also published a comprehensive package of guidelines and documents for the prevention and control, testing, national capacities that need to be taken care of, the commodity package, travel advice, clinical management, surveillance definitions, and things like that. So a lot of things have happened, and by 20th January, on the 21st day, the first World Health Organization's mission was in China to see what was going on. Now, the point I'm trying to tell you this is that until unless we take a very, very active interest in some of these things, we are never going to find out what is happening. There's so much that happens. There is technology, there is manpower, and there is collaboration, which is a big piece of this entire thing. It starts going further, and then, of course, we are all witness. I don't know the United States story side of it. I came to India on March 5th. I landed in India on March 5th, and that was the first day that they started testing everyone that was coming from outside of India with that temperature check. In US, there was not this thing, and I was supposed to be in India for 8 days. But by the time everything, was shutting down, we had gone online. I work for Penn State University, so Penn State University had gone online. I had also visited Mumbai on the 9th and 10th of March. The hotels, I had stayed in Marriott. So because of its international thing, they had the temperature check. Otherwise, there was no mask, nothing, and things like that. So all of this, and again, I can keep going on the timeline, but I don't want to, because I want to talk about the important issue over here, is that why, in my humble opinion, World Health Organization was, in the spot that it was. So historically, if you look at it, World Health Organization is this one agency organization that all of the world has looked up to. And for the most part of it, they have unilaterally accepted its guidance. Because of the participatory nature, there are representations, there are delegates from each and every nation that go and participate. Because of the participatory nature, although some nations have a stronger clout and a more powerful presence, but largely it is still a participatory and a dialogical form of transnational entity. So because of that, most of the times people have heeded to its advice. So when I was thinking about it, and I was doing my research, there were 2 or 3 things that happened. Is that this outbreak of coronavirus has been very atypical. It has been unprecedented. No one could have ever imagined that it was going to go to the extent that it did. Things were getting evolving every day. Every day, new information was being, and you will be surprised that the amount of briefing and information that World Health Organization has put out, it is unprecedented and unimaginable. Daily they've been putting out information because they had to correct themselves so many times. So there was a limitation in the information that they were getting. Plus, the other thing that happened is that the major issue, in my humble opinion, came, or it began, where we had to fight our own selves. Okay. And what I mean by that is that what were the measures? What was the main measure of prevention? And that was, wearing of a mask, uh, distancing protocols. This was depending on the nation and depending on the ideology that drove the nation or drove the leader. It was either overplayed or underplayed. And that is when confusion started happening. So many nations, they said there is no need to wear a mask. There is no need to, measure or take any measures and exercise any protocols. Whereas some nations, they very strictly heeded to it. I am still living in a city where we are under curfew. Every evening, yeah, all the way till until the morning, there is a curfew. So we are still, struggling. And we, India, is one of the nation with almost 1.3 billion people, one of the largest population. But we went through some of the most severe lockdowns in the entire world. For over 40 days, everyone, practically everyone in the nation was homebound. We were not even allowed to go out of our home, because imagine if something like, if you let, it's like letting a wolf, loose in amidst all the lambs. There's just going to be carnage. So although it was very stringent, it was very strict, but it was good. So what happened is that different agencies, they started giving statements. Different leaders, they started giving statements. Some said, no, we are only going to listen to, the medical experts and the scientists. And for them also, this was an evolving sort of, it's like, um, talking about your grandchildren. What your grandchildren was 2 weeks ago is not, what your grandchildren is right now. The personality changes, the personality evolves. Our own kids, in my students, what they, when I see them on the first day of the class, they are not the same on the second or the third day or the next week. Similarly, this one also kept evolving. And then there's like, no, there's nothing, there's no need, let's just go on living our life. I actually come from my extended family. We were one of the first ones to lose people through coronavirus, the first wave of New York and New Jersey. I lost an uncle in the very beginning. One of my cousins was going to deliver a baby, and she herself is an emergency nurse, and she delivered her baby in New Jersey in the thick of the thing. And this little baby is not even 1 hour old and has to be tested for corona and things like that. So information and misinformation has of course prevailed, and there are so many like outlets through which we constantly keep getting more and more information. We are information hungry people. I wish we were not. I wish we could curtail our hunger for information, but the way the entire information age has shaped, we just cannot curtail our hunger for information. And I have some very strong views about the information dissemination and things like that, but I'm not here to share, because I have no desire and no need for information in my life. I can live without it, and I'm very happy without it. But of course, that's not something that I want to bring in. I want to try and keep my biases, my interests, my things outside of this conversation. So that started, and then there were definitely some areas where World Health Organization could have done better. But let me also give you a little background of what I have been. So back in 2016, I was invited by UNICEF. A lot of my work has circled around menstruation, women's health, stigma and things like that. So I was invited by UNICEF. They have a section within UNICEF called the WASH section, water and hygiene for women's health. And they had invited me. And while I was there, I was meeting with some of the heads over there. One of them is in Kosovo right now, and is leading the UNICEF office over there. The amount of it's like there are clubs in Bowling Green, Rotary Club, Zonta Club, Kiwanis Club, and a lot of these. They all run on money that comes from the members, right? And of course, some they have their own money. But over the years, many members, especially after the 2008, 2009 financial crisis, many have not been able to contribute the way they were contributing before. That, along with the unbelievable and exorbitant amount of bureaucracy that has creeped within some of these transnational organizations, has led to some mismanagement at the internal level, where the money is not coming, but the money is still being spent. And of course, these are all things that exist for good cause. So everyone is turning a blind eye towards some of these aspects as well. So that is also happening. World Health Organization, while again it's not in a grave danger that it's going to disappear or anything like that, but it is working on some tighter budgets in certain aspects of it as well. And as this thing started blowing up, nationally, internationally, a lot of other mechanisms kicked in. Politics was being played on this thing. So in my language, Gujarati, there is a saying that koi ni chita balti hoy to you should not tamare tamai chana. So like in India, or in amongst Hindus, we cremate people when they pass away. So the saying goes like, when someone is getting cremated, you should not make use of it or think of it as an opportunity to boil your tea and enjoy a cup of tea. So again, this was very serious, but then there was a lot of political opportunity, that, oh, this is not being handled well, from the opposition, and a lot of mess. So there were some aspects of it that could have been handled well. But in my assessment, World Health Organization has done a phenomenal job. Now, say for example, in US, there is the CDC. Who do we trust more? Do we trust CDC more, or do we trust World Health Organization, or do we trust National Institute of Health, or do we trust what the President of the United States is telling us? When all of these are telling something different or a different version of it, who do we trust? Where do we get accurate information? So there is a major crisis in terms of trust amongst us as well. And we have been put in a very weird situation as citizens and as followers of democratic regimes, where we don't know whom should we trust. Fortunately, that was not the case in India. The Prime Minister has been very clear since day one. I am no expert. I'm going to follow what the doctors, medical experts tell me. I will also tell you of the complex plurality that India is. My friend Bhargav, he's a lawyer in the Supreme Court of India, and his wife's name is Nirupa, and she is a microbiologist, and she works with one of the prominent pharmaceutical industry, which makes vaccines and all these things. The irony over here is that so India is not rolling out the Pfizer and the Moderna vaccine. It has its own Covishield vaccine, which is only 70% effective. So it has rolled that out. So I was having a conversation with them, and I asked her, so when do you get your vaccine? And she was like, well, I don't, We don't really get our vaccine because we are not sort of frontline workers, although we create vaccines and things like. I said, oh, so then like what happens? She's like, you know what? We don't get the vaccine, and they work in the modern science, which here we refer to as allopathy, the pills that we pop, the allopathic form of medicine. So she works and she makes all these things, and she makes the vaccine, she makes for lack of better, Tylenols and things like that. But they, from the company, receive Ayurvedic, which is like the traditional, the Indian, the Hindu rather, form of the traditional medicine, herb-based medicinal. They receive immune booster shots of traditional, medicines. So although they are making modern, these things for their own immunity, they are getting this. So this is the complexity. I'm trying to, give you an idea of how these things. So people who are making vaccines for us, their immunity is being protected by traditional medicine. So now who do I trust? Do I trust, the vaccine maker, or do I trust, the traditional medicine? Because anyways, it's going to boost my immunity, and this thing is not going to creep in. So this is the kind of dilemma, not at the leadership level or at the transnational agency, but also at the ground level. This information has, honestly messed me up. I'm like, they make medicines, but they are being protected by, the traditional medicines, and they always put down the traditional forms of, and of course, everything in balance is fine. But so this is the complexity. Now, from US to India, but then what about the rest of the world? Cambodia. What do you think is happening in Cambodia? Colombia. Of course, people in Cartagena are going to be fine. People in Medellin are going to be fine. What about the Wahiro tribes people? Can they protect themselves? Are they in a position to even understand it? Population of Pakistan is is huge compared to its size. In February of 2020, they did not even have the ability to test for coronavirus. Imagine, there are so many tests being done in the US. Many of you may have also probably experienced it. They didn't even have the ability to test it. And this is Pakistan, our dear friendly neighbor. But there are so many countries where they did not even have the ability to test these things. Another game changer, and I'm just trying to paint this picture, and there are many dots, and just letting you connect them. Medical oxygen. We don't think about medical oxygen. It has been a real game changer in saving lives. The practice, the norm, is to leave out the medical oxygen of the budget. It is never a part of the budget in a majority of hospitals across the world. And the reason is that because its demand is unpredictable. It is not something that whose demand can be predicted. So they never make it a part of the budget. Now, we know that how important a role medical oxygen played in the entire coronavirus pandemic, because people required oxygen. So who was the first one to identify that there's going to be a need and we have to start? World Health Organization. I'm not going to give you any numbers, and I'm not going to keep on giving you statistics, but I'm just going to highlight and illustrate some of the things of how they were connecting and how they were forecasting. What happens in pneumonia? Pneumonia, you're not able to breathe well. Of course, if this goes at a global level, we want to make sure that oxygen is there. Despite so much effort, there were so many people who did not get, you know, oxygenated beds was a huge thing. It was very hard to acquire oxygenated beds because the numbers were so much. But this was something. And I wanted to think about the how the scene was in the United States with oxygenated beds. If that is the case in United States, what is happening in Israel? What is happening in Macedonia? These small, teeny little countries. What is happening in Mexico? Mexico City. They had to 7 million people live in Mexico City. And most of the people over there, they have to come out and they have to work. World Health, they have a Sential, system which constantly keeps monitoring things, and they had to really, really up their game. And of course, World Health Organization backed it because people who supply fruits, people who supply vegetables, most of the people, they go to the market to purchase them. It's not that you press a few buttons, it comes to you, or things like Walmarts don't exist in every place and corner of this planet. We had our vegetable vendors who would, they still come every day, but they were not able to come. So when we were under the strictest of the lockdowns, the only thing that was accessible to us, or which we could access, was M&Ms. And I don't mean the candy, I mean medicines and milk. These were the only two exceptions that were made. Otherwise, if you are out, you are in jail. So if you need medicines, milk providers were given, because of course milk is a very essential part and kids require and things like that. All the pet owners were going crazy over here because they could not go and walk their pets. So the extent of some of the, and then of course if you go 100 kilometers in rural areas, they don't even believe that anything like that exists. They say, oh, we belong to this sort of caste, or this, we belong to this community. Coronavirus doesn't happen to us. There are people with such stark things like that. People in the Siberia, in Russia, the common belief is that cold weather sort of does a few things, and hot weather does a few things. Oh, summer is going to come, it's going to go away. I live in a place where the average temperature is 118 degrees, and we were and we still are one of the worst hits. 118 is the regular normal temperature, and it goes way above that. But we are still under curfew. The time over here right now is 9 p.m. In 56 minutes, it will be under curfew. Testing abilities, testing facilities. So there were four aspects. There are four aspects: logistics, diagnostics, therapeutics, and the vaccine. The logistics of testing. How are we going to test? How are we going to help nations test? How are we going to create these facilities? Do they have it? Do they not have it? Do they have trained people? The taking of swab. Medicines. Do we have certain medicines that can take care of the systems? Of course, this was not in the guide because this is coming out unprecedented. So vaccine development is a huge aspect of it, but I'm not going to go too much. Every nation sort of has taken, because there is a huge economic motivation in vaccines as well. So it is a slightly complex issue, and there have been so many different various opinions about that. India has gone for 70% effective. its rationale is that if we can reach, there are only two ways to reach herd immunity. Herd immunity, I'm sure you've all heard of that. Lots and lots of people, suffering from it. So there are only two ways to reach herd immunity: either let everyone be infected by it, but that's a very, very dangerous gamble, because there can be a lot of life, or you reach herd immunity by immunizing or giving vaccines to a major portion, a major percentage of the population. So India has opted that we are going to reach herd. We are going to acquire herd immunity by giving vaccines to 70 people all across, and let 70% of it be effective. So that's the approach, because just the sheer size of population, and things such as the Pfizer vaccine has to be stored at a really, really low temperature, having those refrigeration, electricity to make sure that it stays well. It's a nightmare. Along with World Food Program, WHO has provided so much support. All the logistics were down, supply chain was down, but it has constantly gone there. So I think I have, sort of highlighted a lot of things, given you a broad overview of a lot of things that have happened. Unfortunately, I don't have time to go into some of the specifics, into like what happened in Indonesia or in Middle East or in Angola, or even in Guatemala, because otherwise we'll not get a chance to have a discussion. And I do want to have a little bit of uh, a conversation. So, but if one of the questions comes, and if I can incorporate that, I will definitely incorporate. So, to summarize, to conclude, I wanted to give you a broad overview of what it does, what this transnational. There is a reason why it's referred to as transnational, and what is the most important thing to remember, that is the World Health Organization, not Indian Health Organization or American Health Organization. So, when we talk about certain issues, it is very important to have that sort of a thing, because I know if I were in US, I would also have understood it in some ways, but since I took a lot of time to understand this, and yes, there were certain snafus on the side, and there were also attempts to undermine what World Health Organization does in a lot of places. So it also had to stick up for itself, and overcome some of these things, because um, they are very dedicated people, and of course there is politics in that as well, but largely, by and large, if you look at their uh, not just a small snapshot but a larger picture, they have done so much. And even if you look at the snapshot, I'm happy to share with you a link of the interactive timeline of World Health Organization, and what they have done with COVID-19. And they have done more than 200 briefings every day, and so much. But they've tremendously done a lot. Of course, there is always a margin and room for improvement. Um, but I don't know. I feel like I should be kind to them and be thankful to all that they have done. And now I think I'm ready for some questions, and or just a dialogue and conversation. And I do want to be mindful that if typing is something that is difficult or challenging for some or many of you, please don't hesitate to just unmute and speak up, and things like that, because that is something that it can be challenging at times, and the right spirit of the question may not come out. So please don't hesitate, and I have no issues with that. So thank you so much.
Perfect. Well, thank you so much, Arpan. I'm going to go ahead and stop